Welcome, everyone, to the Insurance Perspectives podcast. On today's show, we have Dr. Leslie Hammer, Director of the Oregon Healthy Workforce Center and a professor at the Oregon Institute of Occupational Health Sciences. Dr. Hammer specializes in the effects of workplace conditions, including supportive supervision at work and occupational stress, on workplace mental health and well-being. She has extensive experience in designing, implementing, and evaluating worksite supervisor training programs to improve employee mental health and well-being outcomes. Her work has positively impacted workers across various industries, including grocery retail, construction, healthcare, information technology, and the military. Thank you for joining us today, Dr. Hammer. We really appreciate you taking time out of your busy day. I am super excited for this conversation.
Thank you, Kenny. I'm happy to be here.
Awesome. So, we had an opportunity to do this special series on mental health, and it was very important for us to find someone who is actively engaged in the field as it relates to the workplace. Our audience is independent insurance agencies and professionals, people who work in businesses from small to large. And so we want to have this conversation as a foundation for our listeners as they go into further episodes. I'd like to start at square one. What do we mean when we talk about a person's mental health?
I'm going to actually start at square -1, and I'm going to just clarify and place a disclaimer that I am not a clinical psychologist. So I want folks to understand that I am approaching these issues from an extremely important perspective, which is I am a workplace psychologist, an industrial organizational psychologist, and an occupational health psychologist. And so I am trained, I have a PhD in psychology, but I am not trained in clinical psychology. Now, what that means is that what I'm sharing with you is information that is evidence-based, psychologically based, and the recommendations that I make and the perspective that I take is from the workplace, and it's applicable to insurance providers, owners, and really anybody in the workplace. Because what's important is to understand that the workplace has a significant impact on mental health and well-being. And that's what I'm going to be sharing. So what is mental health and well-being? Well, mental health and well-being, it's not just the absence of illness, but it's a state of positive experience. It's the ability to perform, to cope, and to adapt normally. Now, the reality, however, is that many people are not always going to be in a state of positive mental health. And that actually about a quarter of the population at any point in time is experiencing mental health challenges. And what that means is that I am experiencing mental health challenges, our family members are, our coworkers are, our customers and our clients are. So it's not something that just gets put in the back room. This is something that we actually need to be paying attention to in our everyday lives because the prevalence is high. And so we also need to normalize our discussion around mental health because this is part of our life. And what happens is that individuals at any point in time can actually go from positive mental health and they could move into some extremely stressful situations and experience some compromised mental health, and that at times people actually do move into mental illness. And so a recognition that this is part of our experiences and part of work is very important.
Yeah, absolutely. And I think that we were talking in the before we hit record about how this topic is coming up a lot in our space, and it's probably something that, as you kind of alluded to, it's always been here. It's always been impacting a good one in four, it sounds like, or one in five people in that we interact with. But kind of the stress that we've been seeing in the industry that we work in has really brought it to the forefront, and it's really kind of made people tune in. So in your experience and in your research, what impact can a person's workplace environment have on their mental health?
Great question. And I personally have spent the past 30 years studying and understanding what happens at work and how that impacts mental health and well-being. And I actually have been doing this 100% of my research has been in workplaces. So I am not tucked away in a lab. I'm in applied settings, and you shared some of those in your introduction. I mean, I'm in grocery stores. I'm in healthcare facilities. I'm in military facilities. Really across the board, construction, many different occupations. And what we have learned, and not just myself, but many other researchers across the globe, what we have learned is that there are critical aspects of the workplace and what we call kind of, you think about safety hazards, you think about physical safety hazards. Well, I'm talking about psychological hazards. And those hazards are things like interpersonal conflicts at work that cause intense stress. Those hazards include extremely high demands at work. Furthermore, we could look to lack of control over work, and that lack of control really has to do with lack of control over either where you work. Some people don't have control over where they work, and we have a lot of transitions now since the pandemic. But some people have no control. Some people have to actually go into their workplace. They don't have a choice to work from home. Other people do have choices. So control can be where you work, but it can also be how you work and when you work. And so demands, control, pay, the amount of pay that people get affects their mental health. And then a key piece also is support. Is the support that people experience at work from their coworkers or their supervisors and managers. And through decades of research by myself and, again, many others, we have shown significant relationships between these, what we call psychosocial hazards at work and their modifiable conditions of work and mental health outcomes. And so those significant relationships suggest then that there are actions that we can take, interventions that we can implement to actually make the workplace better for people and having to have a less severe impact on mental health. So I take what's called a population health perspective, and that's the idea that our mental health, and it's population mental health perspective. So our mental health is not just the result of our own makeup, but it is the result of our environment. And there are many contextual factors in our environment that affect our mental health, which means that why have we really looked traditionally at just individual level therapeutic ways of treating mental health? Treatment is extremely important. Absolutely, it is important. And individual level behavioral health therapy is extremely important. But we have a crisis across the globe that we don't have enough mental health therapists to actually treat all of the mental health challenges that people are experiencing. And so really let's look at other aspects of our environment for protection of mental health, prevention of decrements in mental health. And that's where I come in as a workplace psychologist, and I have been passionate about sharing information about the importance of the workplace and how the workplace impacts mental health. And it's through what I just described, those psychosocial stressors and hazards.
Yeah, I think that makes a lot of sense. And, later in this series, we talk with an individual about their perspective on, they're spending 8 to 12-hour days with their teams at their agencies, And depending on how busy they are, that might be more time than they spend by themselves or with their family. And so it sounds like what research is showing us and what your experience is informing is, yes, the individual's care for themselves and their individual treatment is important, but it is very key to maybe early intervention or prevention that we also start thinking about the workplace as something that can be beneficial or supportive of the individual.
Absolutely. Absolutely.
Yeah.
And that was the pandemic actually brought light to these issues. Now it's as you said, people have been experiencing mental health challenges for a very long time. This is not something new, but the pandemic brought light to the impact of the workplace on mental health, and workplaces started actually really paying more attention. And then we saw international attention to workplace mental health through in September of 2022, the World Health Organization came out with guidelines on workplace mental health. And then in October of 2022, the U.S. Surgeon General came out with a workplace mental health framework. And I was actually fortunate enough to be involved in the kind of research roundtable that led to that framework for understanding workplace mental health. And then actually in it was May of 2023, most recently, that the U.S. Surgeon General produced a report on the crisis of loneliness, which when you first think about, well, what does that have to do with the workplace? Well, I think it has a lot to do with the workplace, because as you shared at the beginning, I focus on manager and supervisor strategies for promoting and protecting mental health. And part of those strategies have to do with developing relationships with employees and recognizing that, yes, we do spend most of our waking hours with our colleagues, and whether that's virtually or in person, I'm talking about both.
Yeah.
And therefore it is the loneliness piece is key, because our relationships at work are so important, and when they are not good, that affects how we are doing.
Yeah. I think something that it's really highlighting, and this will give me a segue into my next question, but it's really highlighting that this is something that it is beneficial for us to tune into and to maybe lean into, whereas maybe prior generations of working adults would have let their colleague deal with their inner demons by themselves, or they would have been like, oh, he just needs maybe some Alka-Seltzer and a drink, and he'll be fine. But it sounds like what we're really realizing, and what the global community is tuning into, is, hey, no, let's tackle this head on, because that's more effective than hiding it or ignoring it.
Correct. And it reminds me, my focus prior to, it's always been on my interest and my passions have been around employee well-being, and I spent quite a bit of time and quite a bit of my career specifically understanding work-life interactions, non-work interactions, and what managers and supervisors can do to better support work and non-work stress. And this we call it work family more generally, but family refers to all different types of families. But this actually, the field of work family, work non-work, goes back into the 1970s, when there was really a push by activists and researchers that we can't treat these as separate worlds, that how we experience work and non-work is closely integrated. And there was a book that was written by Rosebeth Moss Cantor. I think she was at Yale University, and she wrote The Myth of Separate Worlds, and this was in 1977.
Oh wow!
And it was really the idea that you can't, in the workplace, and especially in the 70s and before, work and non-work were completely separate, and that is not true. That we are we are holistic people, and
Yeah.
this is all part of our life, and we are influenced by our non-work, and that impacts our work, and our work impacts our non-work. And right, we have to recognize that these are, yes, we need to lean, as you said, lean into this, and that this is important, that we recognize that employee well-being is critical for organizational well-being, for workplace well-being. The two are intimately connected.
Absolutely. So then within a business or organization, what kind of roles are best positioned to have a positive impact on the mental health of others and kind of the overall health of the organization?
So size of the organization matters. So in some large workplaces, I mean, there are directors of well-being, there are directors of health and safety, and those directors can be key for really kind of embracing workplace mental health. HR, definitely. But in small organizations, it may just fall on everybody. But I'll just say, across the board, what my research has shown is that managers and supervisors are key, because managers and supervisors have the direct connection to team members, and they also have some power over people. And so that power can be very, very detrimental if it's misused, and it's also scary. And so managers and supervisors need to understand how they really do have an impact on employees and on team members, and that they have an impact both negatively but also positively. And by developing those relationship skills, that can actually lead to positive and improved well-being of the workforce. So that's sort of what I come down to. But again, if you want to have managers and supervisors support and promote positive mental health, there needs to be an organizational culture that also supports positive mental health. And there's a lot there.
Yeah. So everyone's involved, but depending on scale, there could be there are people positioned to have a direct impact in shaping that culture and shaping the experience of those they supervise. I'll tell you that for me, in the last 18 months, I gained my very first direct reports in my professional career ever. And what an intimidating thing to be in charge of the kind of the well-being and the care of people in an organization. And so I think hopefully a lot of our listeners who oversee departments or oversee agencies, maybe as the agency principal or the agency owner, they probably feel that in their bones, but I think it's really worth calling out, like, hey, you can be a force for good, you can be a force for bad if you're maybe not taking care of your own mental health and maybe taking that out on those below you. That makes a lot of sense. Then oftentimes our listeners are agency owners, and they care a lot about their people, but they also run businesses. And I think that's where some of the conflict will come up in these conversations around mental health and well-being in a business. It's kind of like, well, does that really impact the bottom line, our mission here to make money? So I'd love to ask you, is there a quantifiable benefit to a business in caring about the mental health of its employees?
Unequivocally, yes. Yes, there is. And the reason is because if people are not feeling healthy, they're either not showing up to work, or they're showing up and not really able to work effectively. So if you've heard of things like presenteeism, what that means is that people may come to work or may show up and not be fully there because of their own personal challenges. And so there is a lot of motivation for employers, owners to be concerned about mental health of employees. Also, I mean, you can think about, I mean, we're talking insurance industry. I mean, healthcare utilization. I mean, if we can actually prevent decrements in mental health, we can lower healthcare utilization, related to mental health support, mental health, help seeking, and by doing that, so I really am. I take a preventative approach. So as opposed to, and this goes back to kind of the individual level and the organizational level. We need individual level therapists. We need to have mental health supports, but we also can look to the workplace as a preventative environment. And so there's data out there. There's lots of data out there showing relationships between depression and disability. And actually, depression is the leading cause of disability across the globe. I mean, so if we can actually help reduce those risk factors in the workplace, we can help reduce disability, and there are data that show that. There's data that have been reported that untreated depression in the U.S. costs billions. I mean, and we're talking over 200 billion annually in things like absenteeism, medical costs, and lost productivity. There's other estimated costs that have been published, but so there are. I mean, we have to think about what if people are not mentally well, they're coming to work not fully there, and what are those costs? So yes, there is a lot of reason why we should be and why workplaces should be paying attention to prevention and protection of mental health.
Yeah, thank you so much for speaking to that, because I think that it's kind of there's a heavy burden placed on owners or people in charge of large teams where they kind of like, oh, we have to be performative, we have to make our goals, hit our levels and whatnot. And sometimes I find that you kind of not trick them, but you have to like nudge them over that line by clarifying, like, no, look, this mission does serve your ultimate goal. You're trying to make, you want the business to be profitable so you can employ people and help provide for their families and whatnot. Like, there are positive reasons to have that care and attention, but my general position is like, we should care because they're people. But for those listening that need the excuse to get them to that point, or need the carrot to lead them to that point, I really appreciate you spelling that out for them, because I think it matters. Like, these things have a positive impact to business, both on a qualitative and a quantitative level. So your work, and you were very kind to share some papers with us that I thoroughly enjoyed reading. I'm an academic by training. I just don't get to use it very often, and so it was great to get a dive in. So your work has illuminated 6 mental health supportive supervisor behaviors. Could you walk us through those at a high level? Because I think they'll be beneficial to our listeners.
Sure. And you'd stop me if I get too far.
Sure.
So these supportive behaviors, and these are really behaviors I've focused on supervisors and managers, and so what I have focused on is training supervisors and managers on these behaviors. It's not rocket science. It's actually very easy and digestible, and I think that's why it's worked. And so through 6 different randomized controlled trials I have been involved in over the past 20 years, and that is a very extensive rigorous research study in workplaces, implementing this training of supervisors and then evaluating the effects of the training on mental health and well-being of employees. I continue to show that training managers and supervisors in these very basic behaviors has led to positive outcomes in employee health and well-being. And so on a high level, what do those include? Those include, and we call kind of, there's kind of proactive, 3 proactive supportive behaviors, and then 3 responsive supportive behaviors. And I should say that this also integrates work from other colleagues. I mean, this is, I don't do this in, I don't
Totally.
do this by myself. There are many people that are involved in this work. So the 3 proactive supportive strategies are really what we suggest that supervisors and managers really identify and learn that to do this with all employees, So first of all, providing emotional support. And again, it's not rocket science, but what I have found is that managers and supervisors across the board, there's a continuum. And there's a continuum of how comfortable people are in interacting with other people as managers and supervisors. And some do it really well and have the people skills, and some don't at all and have none of, and many people are sort of in the middle. And so what this training has done is it kind of brings people a little bit more to, as a group, moving the needle to doing this a little bit better. So the proactive strategies include emotional support, really making employees feel heard, being authentic with them, showing that you care. Practical support is the second one, and that has to do with being able to make practical arrangements for employees to help them meet their work and their personal demands, or providing resources about leave programs, for example, so family and medical leave programs, but having resources and working with employees on maybe scheduling conflicts. Practical support. And then role modeling is the third proactive supportive strategy. And role modeling has to do with managers and supervisors have to actually show that they are taking care of their own mental health.
Yeah.
And they're not working crazy hours. They're seeking help when they need help, and sometimes even talking about that. So those are some proactive strategies that we focus on. And then the 3 responsive strategies really occur when when in response to kind of some mental health challenges. So first of all, stigma reduction. And stigma reduction has to do with communicating that it's safe and healthy to seek help. And that what we're trying to do is normalize this more, because remember the numbers, it's around us, and we're all experiencing mental health challenges at some point in time. The second responsive strategy is warning sign recognition. So recognizing when an employee is not behaving in their typical way. And typical for you may be very different than typical for me. So what that means is that managers and supervisors should get to know their employees a little bit so that they can recognize if something's off. This does not involve diagnosis at all. There's nothing about diagnosis in here. We are, again, I'm not a clinician, you're not a clinician, all right? We're not talking about diagnosis, but recognizing when something's off. And then if we see and we recognize that something just doesn't seem right, it involves then the third responsive strategy is a warning sign response. So really responding and showing support when we do identify that maybe somebody is not doing okay, providing them with mental health resources and recognizing that they may need more support than what you as a manager or supervisor can provide. So those are kind of 6 in a nutshell.
Yeah.
But what we have shown and what I've been able to show over and over again is that when we train managers and supervisors on these 6 behaviors, that actually leads to reductions in mental health risk factors reported by employees. It's pretty amazing. Pretty amazing.
I when I was reading the paper you provided, these stood out immediately as like, oh, this is so straightforward. And like, because I think people come into these things like, oh, I'm gonna have to go get certified. I'm gonna have to go get extensive years-long training. But these are really straightforward, actionable things that they can take into their businesses probably right after listening to this. I love that you highlight role modeling as one of those proactive support mechanisms, support behaviors, because to me, that's one of the most important things I've ever encountered in my life is, oh, this is what it looks like to be taking care of yourself. This is what it looks like to not only voice these things out loud, but also do them for yourselves. For years, I was a huge proponent. I still am, but for years, I would always tell friends, like, oh, it sounds like you could really, use a therapist. Like, you go talk to somebody, like, that's a good thing for you to have. And my spouse got after me being like, you tell this to people all the time, you don't do it. Like, and I was like, you know what, you're right. I got to take my own advice. I'm going to go get a therapist. One of those things where it's like, I think it is really key. And like, I can tell my direct reports all the time, like, hey, I don't want you working more than 8 hours a day. No one's going to die in the work that we do. You can take time to kind of relax and not feel so much stress. But then if I'm working 10-hour days, what does that really show to people? So that one really stood out to me. And the responsive ones I think are so important. Reducing stigma, that's a huge initiative for this series that we're doing, and why I feel passionate about driving the conversation about mental health in our space with our listeners. Because one, they're gravitating towards it, and two, like, hey, we can reduce these things. Mental health is something that we all interact with on a daily basis. I love it. You offer training seminars for leaders and managers. I'd love to give you an opportunity to talk about that. Could you tell us kind of about the impact you've seen leading training for folks in a supervisor role?
What I have done is, as I mentioned, I've conducted these large randomized controlled trials where we're able to implement the training. And I've done this in grocery, in information technology, in healthcare, and then and military, and then actually across a lot of different organizations. One of the implementations was across a lot of different organizations, and so those are my experiences in implementing this training. It's actually in implementing the training and then rigorously evaluating it with comparing to a control group, and then actually measuring 6, 12, 18 months down the road. And what we find is that we see improvements in both physical health. Now, actually, we've seen improvements, and I should generalize and say that this training, and now I talk more generally about the concept of supervisor supportive training. Mm-hmm. And so what we have seen is that supervisor supportive training has improved physical health. So we've seen improvements in cardiovascular outcomes actually over time. So we've also seen improvements in sleep. Sleep has improved over time. We also see improvements in family outcomes, in maybe relationship qualities with other members of the family. We've also seen improvements in outcomes with children. It's kind of crazy. And furthermore, and I think what's important to this group is that we also see outcomes in workplace outcomes. So we see reductions in absenteeism as a result of this training. So again, it's multi-level training. You train managers and supervisors, and we measure these outcomes with employees. So we see reductions in absenteeism. We see reductions in turnover intentions, and we see improvements in organizational commitment. And then we have also more recently seen reductions in mental health risk factors of anger, as well as reductions in loneliness. Mm-hmm. So, I mean, and I could go on and on with this, but what this training, and most of this training so far has been computer-based training, actually. So I'll mention the seminars in a minute, but most of what we have is standardized computer-based training that's 1 hour. Which is so crazy. I know, so crazy. And so managers and supervisors go through the training in 1 hour. It's they rate it as interesting. They have been engaged, and we also see improvements in learning outcomes for managers. So they learn the concepts from pre-test to post-test. So we see manager learning improvements, manager self-reported reactions, positive reactions to the training. And then we also see all of those improvements that I talked about for employees. And that's all related to the computer-based training, the 1 hour computer-based trainings. Not all workplaces want computer-based training, even though it's scalable. A lot of companies want face-to-face or virtual webinars, and so those have also, I've also conducted those, and less so in terms of evaluation, the rigorous evaluations. So the rigorous evaluations are with the computer-based training, but I have, and actually the next study, because remember I'm an academic, the next study I'm going to be doing, hopefully, is comparing the computer-based training to computer-based training plus a facilitated follow-up session, because I actually think that's the best. I think that's the best option. So lots of outcomes, work outcomes, and individual health and physical health and mental health outcomes.
That's awesome. That is so fantastic. My final question for you, I'd love to know if there are any additional resources that you would recommend our listeners check out if their interest is piqued from this conversation they've been listening to so far.
I'm part of the Oregon Institute for Occupational Health Sciences at Oregon Health and Science University. We have a whole outreach group that does really dissemination and translation, and so we have a lot of these trainings available through our website called supportiveworkplaces.org, and also feel free to email me directly for any questions and any resources on I don't know if you're going to provide my email, but my email, feel free to email me. It's basically hammerl@ohsu.edu. And so we have training resources, and we also have lots of other resources through our Oregon Healthy Workforce Center. We are a total worker health center of excellence that is funded by the National Institute for Occupational Safety and Health, and part of our mission is to provide resources to workplaces, and many of those resources are free of charge. There's other total worker health centers of excellence. There's actually 10 across the country, and you can find those through the National Institute for Occupational Safety and Health, and that's also a great resource in and of itself. NIOSH. So I think that I can go on and on, but I think that probably provides a lot.
Thank you so much. I have thoroughly enjoyed this conversation. I know our listeners will as well. I feel so fortunate that there's an expert kind of in HawkSoft's backyard. We're based here in Oregon as well. Dr. Hammer, thank you so much for your time today. I sincerely appreciate it, and I appreciate all the work that you have done and all the work that you have contributed to that has brought our understanding to this point, because it is really, really impressive.
Oh, thank you, Kenny. I appreciate having this opportunity.
Thank you for watching today's episode. Click the video description below to learn more about our guests and to view the latest podcast episode, as well as other content from HawkSoft. We appreciate you watching and hope you join us next time on the Insurance Perspectives Podcast. Thank you.